Hi, I'm clinical hypnotherapist Stephanie Conkle. So the reason why I'm making this video today, if you read the title, it's what to do if you have if you're hypnotizing a client and you're using the Dave Elman induction on them and they get to the part where you're supposed to test them for amnesia and they don't lose the numbers. Um, so the reason why I'm making a video specifically about this is because in another video that I made, I talked, um, I was telling you about how if you use this resisting clearing method that I have, then doesn't matter what induction you use, it's going to work on the client if you actually resistance before you even put them into a formal state of hypnotic trance. So that that involves using waking hypnosis and a little bit of parts work, and I teach it to you. And of course, you can go to stephanieconkle.com and check that out. It's called Easy and Effective Resistance Clearing. All right, so one of the viewers misunderstood in that video, and he thought that I was going to teach in that class what to do uh, if the client doesn't lose the numbers in the Dave Elman induction. All right, so I'm going to just tell you what to do now because there was a huge misunderstanding and we finally got it cleared up. And so I don't want you guys to be confused by what I was meaning in that other video if you watch the other video is if you do this thing that I teach you first, then it doesn't matter what induction you do, your client is going to be somnambulistic. Okay, so like you don't have to worry when you get to the part of client losing the numbers. All right. So, but what if you don't do that and you just go directly to the Dave Elman induction? And the scariest part for most people, including myself when I first started working with the Dave Elman induction, is the part where you're testing the client for amnesia by having them count out loud and the numbers are supposed to disappear and fade away. Um, so what do you do in that case if the numbers don't disappear and fade away, right? What if they keep counting? So, so many people have modified the Dave Elman induction that because that part's kind of like scary for them, and so they'll have you do things like, or they'll have the client say the numbers in their head, or I don't know, they'll do other things that's not exactly the way Dave Elman set it up. And sometimes that works, but more often than not, what happens is the client goes into a state of aphasia. So aphasia is a cataleptic state, and it's also called fake somnambulism. And fake somnambulism is a really hard place. You know, it's like the worst place you can work from because they look like they're somnambulistic, they're cataleptic, they cannot really talk to you. They look like they appear to be in very deep trance, but their mind is like so focused on you, they just can't get the words out. But they're totally fully like awake, aware, and conscious of what you're saying. So how do you sort of like get the conscious mind out of the way, bring them into deeper somnambulism or into somnambulism, period, and know that they're in somnambulism? Um, Once they're in somnambulism, then they will be able to do hypnotic phenomenon. And according to some of the scales, like the Aaron's depth scale and some other scales out there, it's genuinely thought to be that once the client gets the hypnotic phenomenon of amnesia, then they're in somnambulism. Dave Elman said that his method not only tested for somnambulism, but it actually helped to produce somnambulism. So that's why it's very important to have your client or your volunteer or your patient count out loud and lose the numbers that way. Now, let's talk about losing numbers. So that sounds weird, like losing numbers. Again, what we're actually doing here is we're testing for amnesia. Some people don't want to let go of the numbers because they feel like they're going to let go of control. If you have a very analytical client, and let's say they're an accountant and they work with numbers all day, they don't want to lose the numbers because that's part of their job. It doesn't have to be numbers. It can be anything. It can be days of the week, months of the year. It could be letters of their name. Um, it can be anything. So, oh, hi, Graham. How are you? Oh, you're saying you can't get your sound bar to work. Oh, I hope you can hear me okay. Hopefully it's not your end, or I mean, I'm hoping that it's not my end, but I will go back and watch this video again, make sure that you can hear me, and if not, I'll redo the video. Okay, so let me just continue because I'm not gonna be able to test it out right now. So very quickly. Okay, so it's anything. You just want to test for amnesia at this point. So, but what happens when, let's say they keep counting, right? Um, then what? Then you do. So you're not going to want to modify the induction. You're going to want to back up. All right. So bring them back to their peaceful place. I call it a happy, safe place, their private paradise. Bring them back there. And by the way, don't make any indication that they did anything wrong if they didn't lose the numbers. It's always going to be, you're doing fantastic. That's right. And now just allow yourself to float back to your peaceful place. So bring them back to their peaceful place. And then you're going to deepen the hypnosis from there. So when Dave Elman created this induction, he was doing stage hypnosis and he needed to get the volunteers into hypnosis very quickly. And this was a way that he could get his volunteers into hypnosis within 5 minutes. And he really wanted that to be in under a minute. And also, this is why he taught it to his medical professionals as well, because the doctors didn't have that long with the patient. So they had to hurry up and get them into somnambulism very quickly. All right, so bring them back to their peaceful place, deepen the hypnosis, fractionate, deepen. Really watch for the eye flutter, watch for REM. And here's one little trick that most people don't know who are hypnotherapists, but it's once I learned the secret, it really helped me tremendously. And it's really no huge secret. It's just people, once you know to look for it, then it just makes your job easier. So what you're going to look for, you're going to kind of wait for your client to give a sigh. As soon as they give a sigh, it means that they just shifted even deeper. Once they shift, now you can be pretty confident that they're in somnambulism. And so now we're going to test for it again by having them count the numbers backwards. But this time, don't use numbers, okay? Because they're sort of expecting the numbers. And if they felt like they failed with the numbers, then that's just going to bring up stress and anxiety. So don't use numbers. Use something completely different for them to forget the second time around. Again, days of the week, months of the year, anything like that. And then test again. This time they should be, they should have amnesia. Okay. So hopefully that that helped you guys. Graham is saying it's mine, not yours. Oh, I'll listen to the replay. Okay, awesome. Thanks, Graham. Thanks for watching now. All right. Yes. So if you want more information on how to do the Dave Elman induction properly, I would recommend that you check out his son Larry Elman's courses. And I don't have his website at the top of my head, but Google him, Larry Elman. Larry and Cheryl Elman are wonderful people. They're dear friends of mine now. They're wonderful hypnotherapists. And Larry really teaches his dad's work the proper way that it needs to be taught. So please go check out their stuff. And if you have any questions or comments, leave them down below and I'll try to get to them when I can. I hope you have a beautiful day and I will see you guys later in the next video. Bye-bye.